Hello, my name is Diana. I would like to talk about what I've learned at the Observership with Vios Fertility Institute. Day 0 is also known as the retrieval day. This is the day when the physician will extract the egg, and after the physician has extracted the egg, the embryologist looks at the eggs and determine if they are mature. So only the eggs that are mature will be used, and the eggs that are not mature will be discarded. Then the egg and the sperm will actually create an embryo. And on the following day, the embryologist verify that the sperm successfully fertilized the egg. The following day, day 2, is known as the cleavage stage, and we'll see that the embryo split into 2 cells, then 4 cells, then 6 to 8 cells. And on day 4, we could see approximately 30 cells in the embryo. On day 5, we will reach the blastocyst stage. The embryos are checked to see if they have developed into a blastocyst or blast. There's an inner cell mass, which becomes the baby, and the outer layer of cells will become the placenta. And this is the area that is used for the pre-implantation genetic testing. The embryos can be tested for abnormal chromosomes before they are transferred to the uterus. And if PGT is if the pre-implantation genetic testing PGT is desired, there are 2 types of PGTs. The aneuploid will see if there are any extra or missing chromosomes, and this will determine the presence of a disease. The next generation sequencing-based pre-implantation genetic testing for aneuploidies screens all 46 chromosomes in a developing embryo, and some embryos could have mosaicism. Mosaicism is a condition in which a single embryo possesses more than one genetic line as a result of genetic mutation. This means that various genetic lines. What do we do if an embryo is mosaic? Embryos that are mosaic can have different proportions of normal and abnormal cells. And in order to transfer a mosaic embryo, we'll have to make sure that this will be a low-level mosaic embryo. A mosaic embryo is considered normal if fewer than 20% of the cells are abnormal and 80% of the cells are normal. In that case, we will transfer that. There are a lot of medicines, hormones that are needed for fertility, and I would like to talk about letrozole. So letrozole is a non-steroidal aromatase inhibitor. It works by decreasing the amount of estrogen produced by the body. It inhibits the aromatase enzyme by competitively binding to the hem of the cytochrome P450 subunit of the enzyme, and this results in the reduction of estrogen. So we will see a reduction in the level of estrogens in the patients that are taking letrozole. And by lowering estrogen levels in a premenopausal woman, letrozole causes the pituitary gland at the base of the brain to release the follicle-stimulating hormone, FSH. The FSH stimulates the ovary to produce follicles that grow and mature to release an egg.